All right, imagine a community of about 3 million people. It's not just a small town, but not exactly a mega city either. You've got thriving businesses, universities, and even a medical school, a community that's diverse, vibrant, and has all these moving parts working together.
Okay, I'm picturing it. Like a medium-sized metro area with a little bit of everything. Got it. What are they up to?
Now imagine that this community decides to take things to an entirely new level, not just focusing on healthcare, but on health itself. They form a public-private partnership and commit to completely transforming the way they think about, deliver, and achieve health. And I mean a relentless, almost obsessive focus on health outcomes for everyone, not just treating illnesses, but actively promoting wellness.
Okay, wait. So they're not just trying to improve healthcare delivery in like hospitals and clinics. They're aiming at the big picture, actual health for everyone? That sounds ambitious.
Exactly. Ambitious, but in this thought experiment, let's assume they go all in. Every part of the system, every decision, is focused on the goal of achieving the best health outcomes at the lowest possible cost. And that singular focus changes everything. The way they allocate resources, the way services are delivered, even how people think about their roles in their own health.
You're saying everything changes. But like, how? What actually happens in this community when they make that shift? Paint me the picture here.
Well, that's exactly what we're going to explore in this episode, what it looks like when a community, in a coordinated, systemic way, decides to revolutionize health from the ground up. It's, transformative, to say the least.
Okay, I'm intrigued. So, what's next? All right, so you've mapped out this community, transforming everything to prioritize health outcomes. But let's get into the vision here. How do you even start defining what health for all at the lowest cost really means? It sounds ambitious, sure, but where do you even begin with something so big?
Well, the key is clarity. For this community, it's not just some abstract idea, it's the foundation of everything they do. Health for all at the lowest cost becomes the North Star. It's what they talk about, measure, celebrate, educate around, and most importantly, it's what they actually incentivize. Every decision links back to achieving that goal.
Okay, when you say they're measuring things, what exactly are they tracking? Like, how do they know if they're succeeding or not?
Great question. It's not just about hospital readmission rates or ER visits, although those might play a role. They focus on bigger picture metrics, things like average life expectancy, community wellness indicators, prevalence of chronic diseases, even mental health outcomes. It's about looking at health holistically and asking, are people thriving?
So it's not about curing individual patients one by one, but looking at the whole system and asking how to improve health across the board? That's huge.
Exactly. And what's so transformative here is how they align every part of the system to that vision. It's not just healthcare providers, educators, employers, policymakers, even local businesses. They all play a role. Everyone has skin in the game.
Wait. So you're saying, like, even the school down the street is somehow part of this health revolution? How does that work?
Absolutely. Imagine schools that integrate physical and mental health into the curriculum, not just for compliance, but because they see education as a cornerstone of lifelong health. Or employers offering meaningful wellness programs because they believe their workforce is healthier and more productive when these goals align. The idea is to create a culture where health isn't an add-on, it's baked into everything.
Okay, I can see that. But how do you even incentivize something like this? What's actually motivating people to change how they think and act about health?
That's the beauty of this approach. When the entire system prioritizes outcomes, the incentives naturally follow. Whether it's financial rewards, recognition, or just shared accountability, the focus always comes back to achieving the best results for the most people at the lowest cost.
That's kind of radical, you know? Shifting focus like that, it's got to reshape everything, right? All right, so we've talked about how incentives align within this vision, but I'm curious, how do you actually keep the momentum going? What makes people stay committed to this approach, especially when the results might take time to materialize?
That's where incentives come in. And it's not just about paying people well or offering fancy perks. It's about aligning what everyone does, what they focus on, with the outcomes the community cares about. Take healthcare workers, for example. They'd be paid a base salary reflecting the median for their profession within the state. But up to 30% of their paycheck could come as bonuses, or, yes, penalties, directly tied to meaningful metrics.
Wait, penalties? So it's like your performance has skin in the game. What kind of metrics are we talking about here?
Exactly, and here's where it gets really innovative. Instead of focusing on things like, say, how many patients a doctor sees in a day, or how many papers a researcher publishes, the metrics would be centered around what really matters. First, there's health outcomes, life expectancy, quality-adjusted life years, surgical complications, even falls prevented for elderly folks. It's about the big picture.
Okay, so we're talking actual health improvements here. Got it. What else is on that list?
Second, equity. They'd measure whether disparities, things like Black maternal mortality rates, are actively being addressed. Third comes efficiency, achieving those same health outcomes but at lower cost. Oh, and there's a big focus on long-term health too, encouraging healthy behaviors, preventing disease, things that might take years or decades to reflect in the data.
That sounds kind of overwhelming. Like, if I'm a healthcare worker, am I supposed to keep track of a million different metrics on top of my regular job?
That's a fair point, but no. Even though there might be around 100 possible metrics across the board, only a smaller randomized subset, let's say 20, would be tied to bonuses or penalties at any given time. The idea is to prevent people from gaming the system while keeping it dynamic and fair.
Okay, but what about non-financial stuff? Are we still talking dollars and cents here, or is there more to it?
Oh, non-financial incentives are key too. Things like job security, flexible schedules, or even structuring work to match someone's strengths. If you think about it, it feels a little entrepreneurial, like a group of people innovating, trying to create something amazing that not only improves lives, but does so efficiently at a cost people are willing to pay.
Huh. So it's not just a paycheck. It's a whole shift in how you approach the job. It's like a mix of responsibility, accountability, and, creativity. That's kind of refreshing. All right. So speaking of how these incentives and metrics reshape healthcare, let's drill down into something specific. Orthopedic surgeons. What changes for them in this kind of health-focused community? What does their practice even look like?
Great question. Here's the thing. In a system like this, orthopedic surgeons aren't just about surgeries anymore. Sure, surgeries still happen when they're absolutely necessary, but the focus shifts toward prevention and long-term care. Physical therapy, targeted exercise programs, maybe even behavioral changes. All these become the primary tools for managing orthopedic conditions.
Wait. So you're saying fewer surgeries, more stretching? Is that realistic for chronic joint issues or injuries?
Absolutely. I mean, take something like knee osteoarthritis. There's solid evidence showing that specific physical therapy combined with weight management can delay or even prevent the need for knee replacements. Instead of jumping straight to surgical solutions, patients would engage in these comprehensive, evidence-based programs tailored to improve mobility and reduce pain naturally.
Okay. But aren't surgeries where a lot of revenue comes from in healthcare? Aren't you cutting off a big part of the system's income stream here?
That's true, but remember, this community isn't prioritizing revenue. The focus is entirely on health outcomes at the lowest cost. When you think about it, avoiding unnecessary surgeries reduces costs significantly, not just for the system, but for the patients too. And in the long run, healthier patients mean fewer complications, lower cost overall, and better use of resources.
Okay, fair point. But what about surgeons themselves? Are they just sitting around, waiting for the occasional ultra-necessary surgery to show up?
Not at all. While surgeons may perform fewer procedures, they'd be deeply involved in overseeing cases, ensuring the highest safety standards, and mentoring or collaborating with highly trained PAs and nurse practitioners who might, over time, handle more routine surgeries. Think of surgeons directing care as medical leaders, focusing on tougher cases, or even researching and innovating better care methods.
Wait a second. So you're saying PAs or NPs, non-surgeons, are doing surgeries now? That doesn't sound super reassuring.
It might sound surprising, but why not? Innovative roles need to be studied. Again, it's all about the system prioritizing health and efficiency over inherited conventions, while never compromising on safety.
Okay, I'm starting to see the bigger picture here. All right, so we've talked about orthopedic surgeons. Now, let's shift gears to family practice physicians. How does this big focus on prevention and overall health outcomes change what their day-to-day looks like?
Well, it starts with a pretty fundamental change. They don't just treat individual illnesses anymore. The idea is for family physicians to become health partners, you know? Everything they do revolves around promoting wellness, preventing disease, and addressing the root causes, not just symptoms.
So, like, their whole role gets flipped from just diagnosing and prescribing to, I don't know, something bigger?
Exactly. Imagine a doctor working closely with a patient, their family, and even community organizations to create a tailored health plan. It's not about checking off symptoms. It's about understanding that person's entire context, like their living situation, diet, stress levels, and even access to basic necessities.
Wait, what? So they're not just sitting in a clinic waiting for patients to roll in?
Not at all. Their practice would adapt to meet patients where they are, sometimes literally. They'd spend more time outside the clinic coordinating with social workers, community health workers, maybe even visiting homes to really understand what's going on. It's a team effort around health, involving far more collaboration than most family doctors see today.
Interesting. But doesn't that mean they'd see way fewer patients? Like, how's that sustainable for them?
It's true. The focus isn't on patient volume anymore. Instead, it's about achieving the best outcomes for everyone. Family physicians in this community would have incentives aligned with improving overall health, not just running through appointment after appointment. They'd spend quality time with fewer patients, but the work has a bigger impact. Or maybe new roles, new professionals would emerge. It's not about sticking to convention. It's about accomplishing what we really want.
Okay. Yeah, but how does that work financially? Like, are we just ditching the whole fee-for-service model?
Completely. This system moves away from paying for every little visit or test and instead rewards outcomes. It's about asking, is this family healthier? Have we prevented the hospital admission? If the answer's yes, physicians see that reflected in their pay. But even beyond the financials, it's about purpose, knowing they're making a long-term difference in lives.
Huh. That's gotta be, really different for a lot of doctors to wrap their heads around.
It is, but it's also incredibly empowering. Instead of feeling like they're rushing through appointments or battling insurance codes, family physicians can focus on what drew them to medicine in the first place, helping people live their best lives. It's a shift back to the core of what care should be.
So, thinking about this team effort around health, what happens when you add a public health professional into the mix? Someone who's not just sitting in an office crunching numbers, but actively working with the community. How would they fit into this kind of system?
That's a great question. In this system, a public health professional would have a really active role, kind of like a conductor in an orchestra. Instead of reacting to issues after they arise, they'd be focused on the health status of the entire community, all 3 million people. And here's where it gets really interesting. Their compensation would be directly tied to those health outcomes.
Wait, what? So the healthier the community, the better the paycheck?
Exactly. Imagine this. Their job would be to collaborate with healthcare providers, community leaders, and health educators to identify and respond to the specific needs of the community. They'd be looking at big picture issues, like decreasing diabetes rates or improving mental health, and figuring out solutions that work for everyone. And the healthier the community, the more incentives they'd get.
That sounds great in theory, but coming up with solutions that actually work, especially for something as stubborn as, say, diabetes, can't be that simple, right?
Oh, definitely not simple. But that's where the collaboration piece comes in. A public health professional wouldn't be doing this alone. They'd be working closely with primary care providers to catch high blood sugar levels early, with schools to encourage better nutrition, and maybe even with local businesses to make healthy foods more affordable. It's a systems-level approach, not piecemeal fixes.
Huh. Okay, but they're not just going around with, clipboards and surveys, right? What's the day-to-day actually look like for someone in that role?
Good point. It's not just data collection. They'd be out in the community. One day they might be organizing a health literacy workshop with local educators. Another day, they're strategizing with healthcare workers about reducing emergency room visits. The key is that every action is laser focused on improving health outcomes for everyone, not just for individuals, but for the collective good.
Right? And the big focus here is outcomes, not just, checking off tasks like a to-do list.
Exactly. It's about building a culture of health across the community. And because everything is aligned with that ultimate goal, health for all at the lowest cost, you see this almost obsessive prioritization of what actually works. Less emphasis on flashy projects, more attention on long-term, sustainable results.
So basically, you're saying their mission is to make themselves obsolete, right? If the community is thriving, there's less crisis response needed.
Well, there will always be a need for better health, and that's the beauty of it. It's a relentless focus on prevention, equity, and efficiency. If they do their job well, the entire system becomes healthier, more resilient, and honestly, more human-centered.
Okay, so while we're talking about building this culture of health, let me ask, what about health educators? Are they sticking to the classroom and giving lectures, or are they just as involved in the community as everyone else?
It's a little bit of both, but mostly it looks much more hands-on. Imagine this kind of dual role. On one side, you have university health educators who are teaching future professionals, but on the other, you've got community health educators who are right there in the neighborhoods, working directly with people to address specific health needs. The lines between them blur a bit in this model.
Okay, but how do these educators even know what people need? Like, are they just making guesses, or?
Not at all. In this system, the focus is on health status in the community, things like trends in chronic conditions, access to care, social factors impacting health. Educators aren't tied to inherited curricula or rigid degrees anymore. Their work adapts to the community's needs, which makes what they do very targeted and very effective.
Huh. So it's not about memorizing facts or passing exams anymore?
Exactly. It's less about standardized tests and rote memorization and more about creating personalized, adaptive educational programs. Institutions shift focus from just churning out degrees to genuinely equipping people with the knowledge and skills they need to improve health outcomes for themselves and their communities.
Okay, but doesn't this kind of throw the whole traditional education model out the window?
In some ways, yes. The priority here isn't upholding old systems, it's achieving health for all at the lowest cost. It's a relentless focus. Educators step away from one-size-fits-all approaches and instead tackle very real, very specific community challenges. It's honestly a lot more creative and impactful.
So they're not just like teaching, these educators are part of the health movement itself?
Absolutely. And because their work is grounded in what the community actually needs, they become some of the most influential players in reshaping health. They're not just pointing out where things go wrong, they're actively part of the solution.
Wow, that's a big shift. Less about diplomas, more about making a difference. Got it. So we've talked about health educators fundamentally changing their roles to be more community-focused. But what about the researchers? If you're a university health researcher in this model, what's your day-to-day look like? Are you still chasing grants and publishing journal articles, or has that transformed too?
That's a great place to start. In this kind of system, the role of researchers shifts dramatically. Instead of being hyper-focused on grants or tenure, those traditional academic markers of success, researchers are integrated into the community itself. A big part of their work involves something called community-based participatory research.
Community-based participatory research? Okay, you're going to need to spell that one out for me.
Of course, it's a collaborative approach where researchers partner directly with the community to identify problems, explore solutions, and most importantly, take action together. It's not just about studying people or publishing findings, it's about driving real, measurable change through active collaboration.
So, they're not just sitting in labs crunching data, they're out there working with people on the ground?
Exactly. Take, for instance, a health researcher working with local schools. Instead of just studying childhood obesity, they might co-design a program with parents and teachers to improve nutrition education. Then they track the outcomes, refine the program, and roll it out in other schools if it works. It's action-driven from start to finish.
Wait, hold on. This is more like applied research, right? How's that different from what's called action research, or is it the same thing?
Good question. They overlap quite a bit, but action research often has a heavier emphasis on solving immediate, specific problems while creating knowledge. For example, imagine researchers working with community organizers to address gaps in mental health services. They don't just study what's missing, they design pilot programs, test them, and adjust in real time based on feedback.
Okay, yeah, that makes sense. Kind of scrappy and practical. But does this kind of work actually help, like, long term, or is it just putting band-aids on problems?
That's the beauty of it. It's designed for the long haul. These researchers aren't just solving isolated problems, they're co-evolving alongside the community. By working with others, like healthcare workers, educators, or local policymakers, they build solutions that adapt and grow. It's about creating something sustainable, not just reactive.
Co-evolve. Huh. So they're not off doing their own thing. They're part of the bigger system?
Exactly. And because they're embedded in the system, their focus stays relentlessly fixed on achieving health for all at the lowest cost. That means prioritizing real-world impact over things like publishing papers for prestige. The emphasis isn't on academic accolades, it's on improving lives and driving systemic change.
All right, but I gotta ask, doesn't that make it harder for them, like career-wise? If grants and tenure aren't the goal, what's motivating them to do all this work?
Well, first, many researchers are motivated by purpose, the chance to see their work make a tangible difference in people's lives. But this system also redefines success. Researchers get recognized and rewarded for impactful contributions, whether it's developing a successful community program or achieving measurable improvements in health outcomes.
Interesting. So they're not just academics anymore, they're change makers. I kind of like that. So, we've talked about researchers stepping into these dynamic community roles. But now let's look at the health policy specialists in the system. What's their day-to-day like? Are they just drafting documents in an office, or is it something more hands-on?
Not exactly. It's a lot more dynamic than that. A health policy specialist here would be deeply involved in shaping the entire ecosystem to function cohesively. They wouldn't just be drafting rules. They'd be working directly with leaders in healthcare, education, local government, and even the private sector to make sure policies reflect what the community actually needs.
So it's not just politicians passing bills or, filling out paperwork?
Not at all. It's about designing systems that improve outcomes across the board, making sure resources are allocated equitably and efficiently. For instance, a policy specialist might create legislation that incentivizes schools to integrate nutrition education or that provides funding for preventive care in underserved neighborhoods.
All right, but what happens if they screw up a policy? Like, say they fund the wrong kind of program or totally misread what the community needs. What then?
That's why this system builds in adaptability. Policies aren't set in stone, and specialists monitor their impact in real time. If something's not working, like, a program for reducing smoking rates, it gets adjusted, scrapped, or replaced. It's a continuous process of learning and improving.
Okay, so it's not the old set it and forget it model, but how do they even know if a policy's working? What are they looking at to measure success?
That's a great question. Success is measured by clear, outcome-oriented metrics. They'd focus on health indicators like reduced disease prevalence, improved life expectancy, or even shorter wait times for care. And here's the key. It's not about numbers in isolation. It's about how those metrics reflect quality of life for everyone in the community.
All right. But what about costs? You've been saying lowest cost this whole time. How do they make sure policies actually stay affordable?
Great point. Policymakers rely on data-driven decision-making to allocate resources where they'll have the most impact. For example, instead of spending millions on emergency services for preventable issues, a policy might fund primary care programs that tackle those problems early. It's about being strategic, not reactive.
All right, but that sounds kind of clinical. It's all about spreadsheets and data. What part of this makes policy really, human?
It's not just about numbers, it's about engaging with the people these policies are meant to serve. A good health policy specialist spends time in the community, listening to residents, understanding their challenges, and figuring out how to build systems that reflect their voices. It's policy designed with people, not just for them.
Okay, I'm starting to see it now. They're not just policymakers. They're kind of like bridge builders between the system and the actual people it's supposed to help. All right, I gotta admit, thinking of health systems as these human-centered, adaptable frameworks really messes with everything I thought I knew about healthcare. It's like replacing this rigid, bureaucratic system with something that feels like a living, breathing learning system.
That's a great way to put it. This idea of a learning health system is really about creating something that evolves, something that learns from successes and failures, adapts to the needs of the people it serves, and never stops improving. It's not static, it's dynamic.
Right? And it's not just about fixing what's broken. It's about continuous improvement. I mean, this whole idea of health coming first, above profits or outdated norms, it's kind of revolutionary.
It is, but it's also in a way common sense. When every sector, from schools to hospitals to policymakers, coordinates, adapts, and works toward a shared vision of health, it's amazing what becomes possible. The impact is not just for individuals, but for entire communities across all levels of society.
So it's like this big shift in priorities, where health for all at the lowest cost isn't just a slogan, but an actual North Star that drives every decision.
Exactly. And because the system itself learns, it tracks what works, what doesn't, and adjusts. This approach creates a roadmap for the future. It's resilient, it's equitable, and most importantly, it's sustainable.
You know, I think what sticks with me most is how much this relies on collaboration. Like, it's all about people. Doctors, teachers, policymakers, all these different parts of the system figuring it out together.
And that's the heart of it. A learning health system doesn't put anyone on the sidelines, it brings everyone to the table. It recognizes that health isn't just about medicine, it's about equity, education, environment, and opportunity. When communities commit to learning, to adapting, the possibilities are endless.
Man, I wish every community could hear this. It's kind of inspiring, don't you think? Like, what's stopping us from starting this shift right now?
Honestly, the hardest part will always be taking the first step, shifting mindsets, questioning old models, and committing to change. But the good news? Change can start anywhere. And once it starts, it's contagious. One community becomes a spark for others.
Well, you've definitely given me, and hopefully our listeners, plenty to think about. I don't know about you, but I'm starting to feel a tiny bit optimistic about the future.
And that's a great note to end on. Creating a learning health system is a challenge, no doubt, but it's also one of the most exciting opportunities of our time. And I, for one, can't wait to see where it takes us.
On that note, thanks for joining us, everyone. Here's to learning, collaborating, and hopefully building a healthier future. Take care.